Thank you, Helga, and the organising committee for asking me to talk today. I'm just going to, this is our new hospital. Sadly, it's not as posh as it looks, but we do our very best. So we've been, when the pandemic hit last year, we really recognised very quickly that patients with cystic fibrosis were shielding. And as they went into lockdown, many of them were confined to their homes. And in Glasgow, a lot of people live in tenement blocks or flats, apartments, so they don't have gardens. We also offered attend anywhere virtual clinics and follow-up consultations with our patients. And we realised that obviously there was a need for exercise provision. Our patients who ordinarily would exercise were unable to, and unless you're particularly motivated, it makes it very challenging to exercise independently in your house. We were also aware of exercise as a replacement for airway clearance, and we wanted to ensure equity of access for all our patient population so that they could access exercise where possible. And as Zoe pointed out, we have the standards of care in the UK from a physiotherapy perspective to suggest that we exercise test, we promote activity, and we ask about exercise at every clinic. I was also in a position to be able to promote funding opportunities from the UKCF Trust because they can offer a health and wellbeing grant to enable patients with CF to access equipment. But obviously, again, that's sometimes limited if the space in your home environment is small. So equity of access for our patients meant we were delivering online classes widely to everybody. Physical deconditioning was something that our patients highlighted when they were unable to exercise, and we set about thinking about how we could maximise this. So we fortunately have annual review data, so we already had exercise tests and some representation of exercise tolerance. We knew what the patient's respiratory function was, and we knew if they required long-term oxygen to exercise. So what we did firstly was we evaluated the person with cystic fibrosis needs. So we did that on a clinical consultation first, so asked them in our virtual clinics. And then we surveyed everybody that we had emails for in our clinic population. We tried to find out what their goals would be from an exercise perspective, what education they perhaps wanted from a mental and physical support, and what type of activity interested them. So you can see from the table here that the principal ones that they came back with was they wanted to improve their cardiovascular fitness, they wanted to increase strength, but they also generally wanted to feel a bit better. So we'd already used Paxter, as was previously named and now called Beam, as an opportunity to deliver online activity at the hospital, but we only did it in hospital using their online or on-demand or live classes. So we got together with the Beam team and offered a 6-week pilot of online live exercise classes delivered by our own CF physios using Beam and Zoom. So we offered daily exercises, daily sessions of differing exercise classes that included high intensity interval training, yoga, strength and conditioning, and an easy exercise class, which was in direct response to some of our patients saying, some of these exercises are good, but they're just a little bit too hard for us. Can you downgrade them a little bit? So that's what we did. And we were always in constant discussion with our patients to try to find out what was the best thing for them. So over the 6-week period, we had 28 physical activity sessions and 14 education sessions where the multidisciplinary team and guest speakers were involved. So the focus was principally on exercise. So the education focused on diabetes and exercise and nutrition, bone health, but we also did have other things like spirometry, inclusion of Kaftrio in your armory, and also things like stress urinary incontinence for some of our female participants. After the 6-week pilot, we really felt we had to reevaluate what we'd offered the patients, and we tried to find out how frequently they exercised, for example, after the pilot. So prior to that, we had looked, we had asked how frequently they exercise, but I don't have the comparator, so I apologise about that. But after the exercise, we found that 64% of our population that attended, and there was only survey responses from 23, but 64% of them exercised at least once to twice a week, with the others exercising 4 to 5 times a week or 3 to 4 times a week. Many of them felt that the goals they'd set for themselves were partially or fully achieved. And I believe the 9% that felt that the goals weren't achieved were because the timing of the classes weren't appropriate, or they had to go back to work. Or they were working from home and that had just been reevaluated and they were able to participate more fully in their own employment. The perception of their fitness and their motivation to exercise clearly went up, as you can see from the bar graphs, and we took that as something that our patients were encouraged by, and it kind of led us to continue with the process going forward. We also looked at how many times a patient participated, and we saw that 26 patients attended for 1 or more exercise sessions, and 37 patients dropped in for education. So sometimes there was an overlap of them, but sometimes the people who dropped in for education were clearly unique to the service. Just to put these numbers in perspective, our clinic population is approximately 270 patients, but as everybody's aware on this call, that many patients are very motivated to exercise, and they don't need us as their therapist or their CF team to promote activity, and they're very able to do that independently. But the thing we found really interesting that helped us evaluate what we were doing and plan for the future was, if we look at cumulative attendance for classes, there was 134. That kind of equates to 19.5 hours of our time on Beam. But if we had done one-to-one classes, as was the norm for people with CF pre-pandemic, and because of no group classes, that would have equated to 100 hours of our time. So clearly there's a time efficiency here. Time efficiency for staff, but also for patients, because they don't have to travel to the hospital to engage in pulmonary rehab classes or any kind of one-to-one prehab or post-transplant exercise opportunities. And you can see as well that we kind of saved 66 hours of education as well. We managed to deliver that quite well. The graph at the bottom just highlights over the 6-week period when people dropped in. So you'll see these education bars. These were principally down to when we offered home spirometry to our patients and we did an education class. And the other one was when our consultant talked about the inclusion of Kaftrio, because that's when we started to roll out Kaftrio, and our population started probably in about August of last year. We asked for our patients to give us subjective feedback on this as well, and many of them had felt that they had actually no interaction with any other CF patients since they were children. And obviously, because the online classes removed cross-infection, they felt that this was a safe environment for them to exercise in. Many felt that this would be a really good benefit to them if it was ongoing, and they felt that the education was accessible and it saved them a lot of time. So really, we took this positive feedback on board and we started to consider what we would do going forward. In line with that, we looked at the points of things that we had to consider when we were exercising. The good point about this is we knew all of our patients that attended this live session. So all these patients were known to us, and they felt comfortable that we were reducing risk to them. So initially we would discuss diabetes, hydration, breathlessness, and the difference between breathlessness associated with respiratory exacerbation compared to breathlessness associated with deconditioning, and obviously make amendments for things like if you have gastroesophageal reflux, which exercises were inappropriate. Initially, we had a spotter and exercise modifications for those people who had, for example, rheumatological issues or had never exercised before. And now that kind of leads us to, if there's more than 6 people participating in a class, we'll have two physiotherapists, one in the room doing the exercises and another in another room for social distancing purposes. If a patient was low in exercising, we'd make sure that we had follow-up contact details for them so that there was a safety element built in there. Again, we took on constant class feedback to find out what kind of exercises our patients wanted, the intensity of it, and what the class should be made up of. And we're constantly doing that. So planning for the future, what do we do? So the successful pilot meant we secured funding from ongoing activities. So we actually managed to get funding from CAESI to facilitate this for the next year. The pilot had been set up reactively due to the pandemic. So now we discuss the opportunities for online exercises at every clinic. We have written and email communication to promote this. So we've been sending out flyers regularly. We regularly request the feedback. So we do respond all the time to what the patients say. So for example, if an exercise is too much, we'll reduce it. If there's too many of the same types of exercise, we will change that as well. We felt that this contact with our patients meant that we could react quickly to any issues that they had. And we've also, during the pandemic, been able to implement musculoskeletal support from our physios in-house rather than going through the normal outpatient waiting list. And we can do that through these classes because we can recognise if patients have issues with exercising because of joint pain, we can send them onward referral directly to our MSK physio in our CF team. The patients have felt, obviously, that infection control and time spent has been improved. They've also really enjoyed the opportunity to engage with their peers, and they felt that they've got more out of us as a group, us as a multidisciplinary team as well. They've got to know us a little bit better. And how we've planned to develop that in the future, we felt that early implementation to the transitional group that comes to our service was a really positive step, because obviously, as everybody's aware, we kind of lose young people to exercise if they're not exercising in groups in the early teens. So we transitioned from 14 to 16. So in the transitional clinics, we've been offering our group to the transitional patients to see if they would like to attend either the group as a whole or a specific transitional exercise group. Everybody says they're very interested, but as yet we've not had any uptake on that. However, the paediatric physios have asked about a potential for a mentoring program where we have a podcast or sound bites from our adult exercisers to the younger people to try to give them some sort of direction about how exercise has influenced their lives positively and how it's really made a difference to their management of their CF. And following exercise review group that Owen had done, we considered the opportunity to involve maybe a 6-week pulmonary rehab block to try to have people involved in a snapshot of exercise, to try to garner exercise points, if you like, so to see if we could physically or properly evaluate the benefits of a 6-week snapshot. So that's in our plans going forwards. So what do we do now? Well, actually, we've continued the clinic function, so only our patients can access this. They're available to access the live classes that we offer. We also have a host of on-demand classes that we've recorded and the patients can access. We're going to continue to provide education and with an exercise focus, which I think is important for our client group. We also have felt that the opportunities that Beam offer us, they give us a data dashboard, which you've seen part of, and I'll show you another one in a second. But it gives us an opportunity for them to record who attends the classes, the frequency of the classes, and which ones are attended better than others when we're forward planning. Currently, we offer 6 classes per week, and they work in a 4 to 8 week cycle. So every 4 to 8 weeks, we will change the content of the class so that we can see from start to finish of that 4-week cycle some degree of progression in the abilities of the participants. We've started with a simple field test of timed 1 minute sit to stand, because we can observe a person in our class do that and we can record the outcomes. And we do also have a recognised reference value for that. And obviously it's a little bit safer than doing a step test or a run or anything like that. We've included guest presenters and will continue to do so. And in fact, Zoe dropped in once to participate in a class, and she participated fully and had a chat with our patients at the end of it, which was always very good. We have our psychologists, our nurses, and all education on all aspects of CF management, I think, and that is very much driven by the patient's request. So again, we're driving this forward by the physio team, but the multidisciplinary team is included at every level, and we can manage this within our current staffing levels. Almost the last thing to show you is what the dashboard can offer us. So the Beam give us their data dashboard, and what that shows us, as you can see up here, is the patient demographics. So how many people are new to the service, so that's the purple new Beamers, how many are returning Beamers, so people that have come before, and if they're male or female, and what the age breakdown is. This is also giving us an age breakdown, so you can see that primarily most of our patients that attend are in the 31 to 49 bracket. And this last slide shows us really that although we're offering 508 live classes, many patients also drop into the 111 on-demand classes that they've utilised as well, which is quite encouraging, because we're obviously recording our classes and we don't know what the uptake on that is, but the activity dashboard can give us that information. So the recorded classes have been accessed 111 times, and you can see from the education and movement minutes here how many times our patients are accessing the server and how often they're participating. And you can see that again, this is the first set of bars are when we did the pilot, and subsequently from the 4th of November onwards is when we have re-established the service. And for example, just as an idea, I've just taken a highlight of the 9th of April where we did a high intensity interval training class and 6 people attended that. So we are still, although the numbers are dwindling a little bit, we still do have a core of people that attend our classes. But it's like anything else, you kind of preach into the choir. You always get the same people who are motivated to participate dropping in. But again, as I said, we're constantly trying to reevaluate how we motivate people to attend, how we promote this as a service, and we're hopeful that we can continue doing this in the future. We do have a poster on Thursday the 10th at 12:30 European time. So if you're interested, Gemma, my colleague who is seen here, also will be chatting about our poster. And that's me. I'll take any questions. Thank you very much.